So right now I'm going to perform an airway clearance device. So first and foremost, we always check the patient's chart, obtain any important information, and then especially if they just took up any nebulization treatment. So once inside, we introduce ourselves, then we explain to the patient what we're going to do, such as telling them that this one is an airway clearance device. So this would help and aid you reduce any secretions, at the same time clear up your airways, and it would also prevent any atelectasis or collapse to your lungs. So once we're done explaining that to the patient, we also check the patient's ID band to ensure they're the correct patient, and then make sure we also do obtain vital signs, auscultate them, and then reposition the patient. If they can sit upright, that would be very good. And then they should set their elbows on the table, and then should be relaxed, and they should be in a comfortable state. So we should wash our hands, and then that way we can proceed preparing the device. So ideally, when doing this, we should set the resistance in the lowest level, in the negative. So this one, especially if we started it with an elderly people. So if the patients can tolerate, we can just increase it gradually, but initially we can start it in the lowest level. So make sure we also have the mouthpiece in place or a mask, so that if the patient could not tolerate the mouthpiece, we can shift it to a face or to a mask. So first is we have to let the patient take a slow deep breaths, especially if they put this one in the mouthpiece, and then after that they should do a strong exhalation. And then when they hold this one, they should not obstruct the valve, and then if they blow it up in this device, they should sense any obstruction present, and we should tell them that that is the purpose of this device, and they should continue blowing up against the obstruction inside the device. So after that, every time they do the first trial, make sure we let the patient cough, and then we have to let the patient rest for a few seconds before proceeding to the next trial. And then when doing this, we should let the patient perform about 4, not exceeding more than 10 times. And if the patient complains any dizziness, nausea, or anything that would lead to any complications, we should stop immediately the device and make sure that we stabilize their vital signs. So after that, we let the patient perform it to the patient. So we're gonna start it, we can hold it, or we can let the patient hold. So we have to let the patient take a deep breath, and then strong expiration. And then they can sense an obstruction, then we can tell them that just continue breathing out, just continue breathing out, and then once you're done, after the 3-second exhalation, remove it, and then let the patient cough. If we sense there are secretions, if possible, we have a basin in place, so let the patient cough there, so that we can put the secretions on the basin. So once we're done, we remove the mouthpiece, should wash it and allow it to dry, and then we should explain to the patient that they should not wash it, especially if they will use this at home, and then they should also do this about every hour so that they can practice it more. And then they should not obstruct it, and then we should also tell the patient that they should not do this together with the nebulization treatment, because it will lead to clumping on the flutter valve. So once we're done, we make sure that we will also reassess the patient, obtain also post-viral signs, and then we make sure that the patient is comfortable, not feeling any dizziness at all. And then once we're outside, we make sure we sanitize our hands, and then we make sure we have to communicate with the physician or the nurse in charge that we did the initial therapy, and then what our initial observations is. And I think that's all.